Welcome to this special live edition of the eClinicalWorks podcast here at the National Conference. I'm Adam Salati, and while much attention these days is being paid to AI and the potential therein, prescribing medications is still a core part of many providers' day. But this fundamental task is often far from straightforward and can bog down prescribers and patients with uncertainties about coverage and additional authorization steps. But fortunately, a number of technologies are now available to address these pain points and streamline the process. Joining me today are Kathleen Kostelnick, President and Executive Director of Business Operations, and Leanne Knight, Director of Health Informatics, to discuss how Pioneer Physicians Network is implementing several strategies to simplify workflows and exceed key operational and value-based care metrics in what they call informed prescribing. So glad to have you guys both here again on the podcast.
Thank
You're
you,
multi-time guests on the podcast, so everyone out there, we know it must be good. So Leanne, why don't we get started? What are the components of your informed prescribing process?
4 key eClinicalWorks features, a few that have been around a while. RX Eligibility and formulary checking, generic alternatives, RTBC, real-time benefit check, and the newest feature, EPA electronic prior authorizations.
So let's get into a little bit about what you're doing with those, how you're using them, and where you're seeing the effects of some of these tools. Let's start with the RX Eligibility.
Perfect. So RX eligibility and formulary checking is historically been around for, I've been a user of eClinicalWorks for 16 years. And if you all have used eCW for as long as me, you would know that you would see smiley face indicators at the point of care, indicating if something was covered or non-covered, which was helpful. But eCW has expanded upon that feature with real-time benefit check. And not only does real-time benefit check offer coverage, but instead of average wholesale price, it offers up the physicians at the point of care the cost to the patient directly at their pharmacy of choice. So mail order pharmacy, local pharmacy, whatever is in the patient's chart will be available at the point of care. That really supports shared decision making, right, between the patient and the physician, allowing the patient to understand what the cost is going to be at the point of care. And if that cost isn't comparable or acceptable to the patient, the physician can pivot, make a decision on an alternative med that is suggested with the real-time benefit feature at the point of care. We all know that patients being involved in shared decision-making and then being able to afford the medications drives compliance too. And obviously compliance drives an alignment to value-based care, right, with medication metrics as well.
And there's often a lot of uncertainty for the patients when they're leaving the office. You know, all they know is the provider wants me to take this medication, right? They don't know how much it's going to cost. They don't know if it's necessarily covered or not in some cases. But now you're addressing a lot of those things right there so that they can trust that their provider is helping to guide them to this option. What about the generic alternatives, though?
So generic alternatives feature is a must-use. It's been around for years. It's easy. It's at the point of care. You need to train your physicians to use it and leverage it. Generic alternatives has allowed us to achieve highest targets on our value-based care performance metrics with regards to generic prescribing. In some of our contracts for our pediatric population, we've achieved 100% in generic prescribing metrics and the highest benchmarks for our adult populations. So it's easy, it's there, and you don't have to know the generic names. It pops right up for physicians when prescribing.
That certainly makes it much easier. And, and again, bringing the patient into that conversation, if the patient says, the provider can say, here's how much it looks like it's going to cost based on your insurance, based on, whatever else is in place. And if the patient then says, I don't know if that's going to work out, they can suggest some alternatives right there. Electronic prior authorization. This is a bit of a newer feature, right? But you're already making great use of it in Pioneer?
Certainly. I'm excited to talk about EPA and how we've leveraged it. It really has given us the most improvement in operational efficiencies for both the staff and the physicians, as well as patient satisfaction. It's really a proactive approach rather than being reactive. So, a little bit more about that feature. And if we go back to how prior authorizations used to be before this feature, the physician would send a prescription to the pharmacy and the patient leaves the office, right? And they go to the pharmacy only to find out they can't get that prescription that was prescribed for them. And they either have to wait several days, they call their physician's office, which is a message into your office. Sometimes the pharmacy faxes a document to the doctor, so that's a document for the physician to do. And then it's a waiting game, right? It's tasked to a staff member to initiate the process, or perhaps the physician changes the medication, right? Well, with real-time benefit check and EPA, you can change the medication if needed at the point of care. So that EPA process has really been transformed. Now with the integrated EPA, it's an easy button at the point of care. The physician is alerted with a yellow button if an electronic prior authorization is required for that particular medication. And from that point, they can click on the button and it instantly tasks to an assigned staff member. So whatever staff member or group of staff members that we have at Pioneer to handle will start the process at that point before the patient even leaves the office, right? So the patient isn't driving to the pharmacy. That process is sped up because there's not days of waiting. Patients are happy. They're satisfied. They leave knowing. The other benefit to that is the medication doesn't go into the chart. It pens. So you don't have an inaccurate medical record, right, if it's shared later, or a medication, if it doesn't get approved, to stop later and add a new one. It's pended. Once the approval is obtained, then the staff member sees that pended medication, they can inform the patient, and they can send it off to the pharmacy on the physician's behalf.
That's excellent. Now, you have been using the electronic prior authorization for, I think you said, about a year now. What kind of volume are we talking about? How big of an impact is this having?
Utilizing this feature is huge. So we implemented in November of 2023, so almost 1 year. And I can tell you that Pioneer Physicians Network has done over 12,000 electronic prior authorizations from that point. So when you think about a task that is that common, any reduction in time and efficiencies to that task for the physician, the staff, is beneficial to the operations of the practice.
Absolutely. Now, we're already talking about, what impact is this having on patients? And I know, with things like a lot of urgent cares popping up and things like that, you really need to do a lot too to keep the patients happy and coming back and going to you as a place that they can trust as well. So I think these improvements have a lot of knock-on downstream benefits to streamlining the process. I wanted to ask though, even though this is sounding like it's having an impact at your individual offices, I wanted to understand maybe from Kathleen how this is what you're doing at Pioneer to scale this up, and the difference between the small site and like maybe the large organization.
Yeah, thank you. So Pioneer Physicians, we have 19 locations and over 70 providers now with APPs, and we have been building for quite a few years now a centralized services support center, and basically that's what it is, supporting those who take care of patients. So we have centralized referrals, centralized document management, some centralized scheduling for new patients. And so this year we started centralized prior authorizations. So all of the steps that Leanne's been talking to comes over to a centralized service area. And our physicians have been happy, the patients have been happy. Again, it's the easy button. We call it, for the doctors, free your mind. So they're able to put their order in and then know that a team of about 6 to 8 people are taking care of the patients and making sure things are provided. Our mission statement centers around high quality and cost effectiveness, and this has dealt right into that and follows our mission statement.
Now, I wanted to ask too, you are a larger organization, you have a number of providers, large number of providers that are working together, and of course, you're centralizing that process to try to take advantage of, economies of scale and things like that. But I wanted to also just ask you, are there any pieces of this informed prescribing strategy that can't work at a small office?
We think it absolutely can happen at a small office. Again, maybe have a dedicated staff member or a couple of team members at that, but you can absolutely scale it. And again, with the electronic and the automation piece of it, and all of the alerts that you're getting to help with the support for the patient, you absolutely can scale it down to a small office.
Yeah, and I think 3 of the 4 things that you mentioned today are point of care things, right?
That's right.
So you have a provider, your point of care, those are helping right there in the middle of the process.
Right.
And maybe the prior authorization can go to a centralized team.
And it's all about getting rid of the administrative burdens, right, in the office so that they can take care of patients while we take care of the administrative things. So, absolutely.
Well, we're thrilled that you guys are putting these tools to good use. I'm sure the practices that watch this podcast or that have seen this conversation here will have some things to take back and think about and put in place in their practices. Kathleen, Leanne, thank you again so much for being here once again on the eClinicalWorks podcast.
Thank you, Adam.
If you'd like to learn more about any of the tools or features that you've seen here on today's episode, make sure you reach out to your strategic account manager or visit my.eclinicalworks.com for more information. And also, don't forget to subscribe to our podcast, where we have many more conversations just like this one with customers like you about the ways that they're putting tools with eCW and Hilo and Suno and Genie and everything else that comes with it into place in their practices. Thank you very much for joining us. I'm Adam Salati for the eClinicalWorks podcast. We'll see you next time.